welcome to another episode of Oral Arts Quick Tips from the Lab. Today I wanted to go over our Anterior Zirconia product, Ultra Z. Anterior Zirconia has been out around 2 years now. The Anterior Zirconia powder is coming from Toso in Japan, and it's a specially formulated zirconia specifically for dental and high translucency applications. We originally started out in this segment of the crown market with Brux or Anterior, and we stopped using Brux or Anterior and went with our own brand Ultra Z at the beginning of this year. Since then we were milling Cap Anterior, and we just recently switched to the new Katana zirconia, and this particular zirconia is blended with a shade, multi-layer shading. It's one of the only kind like this on the market. The benefit to us and you and the patient is you get a much better aesthetic with the blend from the gingival, body, and incisal blend. It requires the technicians to not have to do as much external staining, which we all would love to avoid. So we went with Ultra Z because it gives us the freedom to use the newest, greatest materials like Katana without having to go through a whole renaming process of the product. In terms of the application and the indications, you would use this material just the same as you would use your Emax. The megapascal strength is 550, so you're going to gain some strength over your Emax and a little bit less aggressive on the prep. Whereas Emax, we would like to see 1.5 millimeter in the posterior. We can get away with 1 millimeter with the Ultra Z. So it is contraindicated for posterior bridges. We can bridge 3-unit bridges back to the first or second bias, the most distal abutment, but I would not recommend this material to bridge in the molar region. What I did today was just went through the lab and randomly sampled some cases of what we were getting. I didn't screen these cases in any way. I just grabbed them. I saw they were Ultra Z's and just went for it. So one of the cases you can see is a 3-unit bridge, 8 through 10. We did have to trim some on the opposing to get some more clearance. Not a whole lot of aggressive opposing trim. This is a great case for Ultra Z using the Katana. I would like to see a little bit more of a chamfer margin. When you're prepping the Ultra Z and Emax especially, it's good to have a chamfer margin. Doctors are used to doing feather edges oftentimes when doing the posterior zirconia like Brux or Element Z. And then here we have a premolar, number 12. This is a great case for Ultra Z Katana. The only thing here is it would be better to have, again, a little bit more of a chamfer margin. On the number 30, pretty much the same story. This is a posterior molar crown. We have doctors, as you can see, are doing these on molars. It's totally fine to do on molars. The same way Emax is fine to do on molars. However, you do need to make sure you get some good occlusal clearance for the strength. And here we have a number 8, single central. This should be fine. And we are doing a C shade. This material looks really good in all the shades, and I don't have any problem matching shades using the Ultra Z. Regarding the cementation, you can eventually cement this like you do your regular zirconia. Nortaki Carrare just came out with Panavia V5, and using Panavia V5 you can actually use Katana to do anterior veneers, which is revolutionary in terms of doing veneers. We have rarely done a zirconia veneer, but now with the V5 you can bond these like you would an Emax. And we will actually be documenting a case with Dr. McComey in the coming months of an anterior Katana case cemented with V5. So I hope that helps you a little bit understand the Ultra Z material and also the new Katana discs. We're very, very excited about this new material. Encourage you to give it a try. Thank you all.